Welcome to the session on strengthening supports for employees with episodic disabilities. This session examines the successes and challenges of 3 initiatives to create disability-confident workplaces while strengthening supports for employees with episodic conditions. Before I introduce our presenters, I'd like to talk just a bit about what is meant by episodic disabilities. My thanks to Monique Gignac, one of our speakers, for providing some background on this. Episodic disabilities is a term being used to describe a range of chronic conditions that can be very different in nature, but share 3 key characteristics. They are intermittent, unpredictable, and invisible. As a result, they often share similar impacts on people's personal and working lives. Statistics Canada sometimes calls them dynamic disabilities. Just to go over these 3 characteristics a bit. Episodic disabilities are intermittent. People do not always experience signs or symptoms of their condition. Symptoms come and go. The condition may be well managed with treatment. Episodic disabilities are unpredictable. Even if well managed, symptoms of these health conditions can still occur with little warning or suddenly flare up. And episodic disabilities are invisible. In many cases, others aren't aware that a person lives with the health condition unless symptoms are occurring, or a person has disclosed the information to others. Unfortunately, many times, symptoms may not be interpreted correctly by others. They may be erroneously attributed to causes other than the condition. Examples of health conditions causing episodic disability are Crohn's and colitis, depression, anxiety disorders, arthritis, multiple sclerosis, irritable bowel syndrome, migraine, epilepsy, some types of cancer, and HIV. 3 projects will be presented that seek to provide employers with the information, skills, and tools they need to foster inclusive workplaces for people with episodic disabilities, while also providing employees with resources to thrive at work. 3 projects will be presented that seek to provide employers with the information, skills, and tools they need to foster inclusive workplaces for people with episodic disabilities, while also providing employees with resources to thrive at work. We have 3 presenters for this session. In turn, they will be Dr. Monique Gignac, Senior Scientist and Scientific Co-Director at the Institute for Work and Health, Melissa Egan, National Lead for Episodic Disabilities at Realize, and Helen Anderson, Director of Information and Support at the Arthritis Society. I will first then turn to Monique.
Thank you very much, Ron, and good afternoon, everyone. Thank you for joining us. I'd like to talk a little bit today about a large partnership grant that focuses on creating tools and resources in the area of accommodating and communicating about episodic disabilities. You can see that we have a large team here, and it includes Ron Saunders, who's our moderator today, Melissa Egan at Realize, and Helen Anderson at the Arthritis Society. We're funded by the Social Sciences and Humanities Research Council of Canada and the Canadian Institutes of Health Research. We've also received some dissemination funds from Employment and Social Development Canada. I want to pick up where Ron left off in defining some of the conditions, and note that people living with an episodic condition often have to make decisions about whether or not to say something, to disclose some private health information at work. And these decisions are often stressful and complex. In addition to that, many workers aren't familiar with privacy legislation that protects them from having to disclose disease diagnoses and symptoms, and they're unsure how to talk about their health needs or how to focus on job-related activity limitations and not more of disease symptoms. We've also done research with workplace representatives, and they tell us that there are a number of challenges in providing support related to a workplace culture, related to misgivings that people may have within an organization about the skills and the training of others, and their role in the communication support process. And they often note conditions where workers choose not to share their health needs, but where there is an impact as being among the most challenging that they face. So the bottom lines for us were that workers want guidance on whether to communicate at all, what their options might be, and what, when, and how to share information. And there seems to be a real need for a more consistent and comprehensive approach to assessing job demands and support needs so that we don't get this variability within and across organizations. So among the various activities we've undertaken as part of this partnership grant, we've done a resource scan of existing publicly available materials that provide advice related to disclosure and accommodations. We don't want to reinvent the wheel if we don't need to, and there is a lot of good work out there. We've also undertaken quite a bit of new research. We have 2 large surveys with over 1,600 and 3,000 individuals in each. We've done focus groups with older workers. We've done one-to-one interviews with workplace representatives who provide support, like supervisors and HR and others. And we've provided students with a number of opportunities to really mine down into some of these issues so that we can learn more. I want to talk today about 2 tools and resources, really mostly one, the Job Demands and Accommodation Planning Tool, or the JDAPT, but I'll highlight a little bit of what we've been doing around our communication decision-making tool. I think our aim for all of our tools is very much the same. We want to create tools that are easily accessed. We really want them to be personalized and interactive, not a list of pros and cons or lots of material that you passively watch but or look at, read, but something that's really much more interactive and personalized to an individual's own situation. And of course, we need them to be evidence-based. We will not be giving advice with our tools. Instead, we really want to promote discussion. We want to facilitate brainstorming so that individuals can come up with the decisions that are right for them. Now, in terms of our Job Demands and Accommodation Planning Tool, the JDAPT, we've created 2 versions. We have a worker version and an organizational version. The worker version allows someone to self-assess their needs and identify areas where they are maybe having some difficulties, and then link them to a wide range of support and accommodation strategies. The organizational version is the same, but this can be filled out by someone at the organization on their own, thinking about a worker. We want to create one that might be helpful for onboarding, or it could be filled out by someone at the organization with an employee. We've divided our tool into 4 broad domains. So we have physical tasks, and there are 5 demands there. We have mental or thinking or cognitive tasks, 6 demands there. Working with others and working conditions. We have 5 areas in the working with others, interpersonal demands, and 8 in the working conditions. This is not a formal functional assessment tool or a cognitive demands tool. These tend to be very in-depth for very specific jobs. We want this to be applicable to a range of different conditions. So I'm going to give you here just one example of a question from each of the 4 domains. So for the physical domains, is moving around or working in awkward positions or postures an important part of your job? And what an individual would see is immediately a wide range of examples that are tailored to all kinds of different jobs. The person would say yes or no, this is important to my job. If they say no, they get moved into the next demand. They skip out. If a person says yes, they're then asked if this is difficult, to what extent this is difficult, and how much of the time. Is this a consistent, constant difficulty, or does it occur now and again? So for each of these job demands, that's what you would see. The blue demand at the bottom there is for cognitive demands. It's an example, again, one of 6, is responding to changing work demands, an important part of your job. Again, you see a wide range of examples, and you go through these. For interpersonal demands, an example is communicating, negotiating, or motivating others, an important part of your job. And then finally, one of the work environment questions, does your job require working around distractions? So again, we have 24 of these. They can be filled out very quickly if it's not relevant to the job or a person's not having difficulty. What we do is we would create a summary report of any of the items that are difficult for a person, and they link individuals to a wide range of supports and accommodations. And those are very personalized. An individual can check off that, yes, I've used this before, or this would be relevant to me. And I've just provided here an example for physical job demand, moving around or working in awkward positions or postures. You see a list here. Our goal was to have things that an individual could do without having to get permission, some lifestyle, some self-management, like engage in regular physical activity or get professional advice for care for injuries. Planning movements to avoid injury. All of these you wouldn't have to check with a supervisor. There are some that you might, requesting an ergonomic assessment or using kneeling protection, for example. This is just a few of the examples that we have. Give you one more, just to show that they're quite different for a different type of job demand, like responding to changing work demands, which is one of our cognitive demands. Now you see, again, more lifestyle, like get plenty of rest outside of work, or practice mindfulness and positive self-care, but also some other things you can do at work, like prioritizing work tasks according to deadlines, asking others for assistance. Again, you might need to be sharing a bit more information here. So these are really targeted to specific job demands. What we've been doing over the last year is a lot of pilot testing of the JDAP to really focus on the ease of understanding, the interpretation, and really making sure we have items that are relevant for different episodic conditions, occupations, and also across personal characteristics like gender and age. We've consulted over 20 research experts. We've had 12 of our partner representatives from different health charities provide their input. We've also done hour to hour and a half interviews with 46 workers who live with different types of episodic conditions, 23 organizational representatives, again, to really get some insights here. Just a little bit more information. You can see that we've mostly spoken with women, so we do want to bring more men into this dialogue. We've had a good range of people across different ages, which was really important to us to make sure we weren't omitting younger workers or older workers. We've also had a range of people from different sectors, although we would like to increase our numbers in sales and service, as well as in primary industries and things like construction, utilities. But we do have representation on all of those. We found that it takes about 14 minutes, but there's a huge range, 4 to 38 minutes, depending on the difficulty people have with their health at work. Participants liked the JDAP. They found it simple. They found it easy to use. They found it made them think in different ways, which was really important to hear. Our workers told us it was a little easier for them to fill this out and useful than organizational representatives. That was mostly because organizational representatives sometimes said it was hard for them to know whether a worker was having difficulties because of their condition or because of some other reason. Our feedback was mostly clarifying instructions and adding examples. And right now what we're doing is we're putting this all online and hope to have this ready early in the new year for people to do some additional testing and to start using. I just want to finish with one last slide here, and that is our communication decision-making tool. It's in an earlier stage of development. Again, though, we want to make this very interactive. And one of the ways that we want to do this, we've really culled a lot of literature here and done a lot of research on our own to kind of break things down into 5 broad areas where we'll ask people about their current work situation, why they're thinking of sharing information right now, what their goals are. For example, are you just sharing because it's what you do and you want to build trust, or do you need some help? What matters to you? We know people are very different in their personal needs and their preferences for sharing. So what do you need to think about in terms of your own preferences? What do you need to think about in terms of your organization and the support you feel you have or the lack of support that you have? And when should you say something? What do you need to think about now in the future? So that's to come down the road in 2021. We'll be sharing more about that. And I'll just pause here. I know we're going to take questions and comments at the end of our session, but I'll just flag that we do have a website. Hope that you will check it out, and perhaps if you're interested, join us in some of our testing of various tools and resources. And I'll stop here, Ron, and turn it back over to you. Thank you.
Thank you, Monique, for that presentation. And we are now going to turn to Melissa Egan.
Hi, everyone. I'm going to tell you a little bit about Realize. We are a national nonprofit, and what we try hard to do is foster positive change for people living with HIV and other episodic disabilities. We have been around for a while, and maybe you heard of us. We used to be the Canadian Working Group on HIV and Rehabilitation, but that was a bit of a mouthful. So now we're called Realized. We've been bridging traditionally separate worlds of HIV, disability, and rehabilitation for quite a while now. And what we do is really try and make the daily lives of people with episodic disabilities a little bit better through direct ways and meaningful ways, through research, education, as well as policy and practice change. We are the Secretariat for the National Episodic Disabilities Forum, and this is a group of strong and engaged advocates, government representatives, stakeholders, and people with lived experience. There are about 60 of us now, and we really work together to build awareness as well as to create policy change, and we've been relatively successful in that over the years. We also develop reports and policy briefs and other pieces of writing and present at committees. We're really working towards trying to create an awareness of episodic disability around the country. We are a knowledge mobilization partner on national and provincial grants. We also are active in policy change work with government representatives and other advocacy groups. And we have multiple online course offerings. I invite everyone to have a look. There are more coming in the new year, so keep an eye out on what's going on with Realize. The Revamped project is something that I'm going to tell you a little bit about today. It's called Workplaces Revamped, or Recognizing the Value of Employees with Episodic Disabilities. What we want to do is increase awareness of episodic disabilities among employers. The project work will increase the understanding of episodic disabilities among employers and some of the challenges that are related to work and what employees with episodic disabilities are dealing with on a day-to-day. We're trying to build the capacity of employers to be responsive and effectively responsive to some of those challenges. So we create professional networking opportunities through some of the groups that we've gathered together so that we can develop some leading accommodation practices. We are also supporting people with lived experience of episodic disabilities to really communicate more effectively about their lived experience. We have been undertaking this work for around 15 years. And for the people that have been a part of Realize's work, there's been some real change in their understanding of episodic disabilities. However, we know that the sheer numbers of people who are living with episodic disabilities in Canada really does require an ongoing and consistent expansion of the work. So what are our goals here? The strong partnerships that we have developed really take place in a couple of different areas. We have created the Employers Network on Episodic Disabilities, and that's about really leading employment-related services, such as needs assessments and counseling and program interventions that will be tailored to meet individual needs. What we're hoping that this achieves is providing people with lived experience some work experience and sometimes connections with folks who might even be able to support them to start their own businesses. These alliances are incredibly important. We support people with lived experience with opportunities to co-present a particular workshop that has been in development for the last few months, so they're able to build skills and build confidence in talking about episodic disabilities, but also connecting them to employers in a very unique way. How do we do this? Well, I talked about the Employers Network on Episodic Disabilities, but we also do this with an advisory committee. Our advisory committee is full of really amazing people who are living with episodic disabilities from around the country, and soon they will be participating in a storytelling workshop that will build those skills around talking about episodic disabilities in our work context. The Employers Network has 12 active members, and we've got people from all kinds of different industry, HR representatives, diversity specialists, executive directors from nonprofits, people who work at banks and pharmaceutical companies, even an occupational health nurse. This is a really wide range of individuals who are contributing to the products that come out of this project. And what we are trying to do is to build self-advocacy skills as well, and connect folks with employers. So what have we done so far in this project? Well, we developed the workshop. It's called Episodic Disabilities at Work, and any interested organization can contact me and take part in a presentation that happens online. And there's always a piece within that presentation that is a speech or a bit of a conversation with a person who's living with an episodic disability. We have also, with the incredible support of Monique Gignac and her team at the Institute for Work and Health, created a policy brief entitled Should I Tell Them? Working Towards Barrier-Free Recruitment in the Canadian Labour Market. That has been translated into French and English and is available on our website now. I encourage you to have a look. So what's happening next? What are we doing? So the storytelling workshop is coming up for our advisory committee, and we think that's going to be a pretty exciting opportunity. And I invite everyone to keep an eye on Realize's social media and on our website, because we will be hosting a National Episodic Disabilities Summit in March of 2021. So I may be in touch to see if you might want to present. That's all for me. Thank you very much to the Disability and Work Conference for inviting me to present. Over to you, Ron.
Thank you, Melissa. Our last presentation is from Helen Anderson. Over to you, Helen.
Thank you, Monique and Melissa. It's been a pleasure being involved in the ACE and revamped project. As Ron mentioned, my name is Helen Anderson, and I'm the Director of Information and Support at the Arthritis Society. If you're not familiar with the Arthritis Society, we are a national bilingual health charity founded in 1948 with a vision to live in a world where people are free from the devastating effects that arthritis has on lives. Our mission is to invest in cutting-edge research, proactive advocacy, and innovative solutions to deliver better health outcomes for people affected by arthritis. In terms of arthritis as a condition, it actually describes over 100 diseases characterized by inflammation in the joints and other parts of the body, which can cause pain, stiffness, swelling, and fatigue. It can lead to irreparable damage, loss of function, and disability. Today, 6 million Canadians live with arthritis. More than 50% of people with arthritis are under the age of 65. Additionally, 1 in 4 women and 1 in 6 men in Canada live with arthritis. While arthritis doesn't necessarily cause disability in everyone who experiences it, for those who do have more severe symptoms, having the supports they need can make a huge difference in terms of ability to participate in the workforce. And arthritis is episodic in that there may be times when symptoms are lesser than others, and then times when a person experiences a flare. In terms of the larger context, arthritis is one of the most common chronic diseases and a leading cause of long-term disability in Canada. Canadians with arthritis between the ages of 20 to 64 are twice as likely to report not being in the workforce compared to people without arthritis. So 35% of people with arthritis report being out of the workforce versus 17% of people without arthritis. And this statistic comes from Badley et al. This statistic and further research in this area demonstrates a need for support for starting and staying at work for people living with arthritis. The Arthritis Society then decided to create an Arthritis and Work resource hub. Some of these resources have been created with support from the Government Ontario's Enabling Change program, and they draw on the extensive work and expertise of Dr. Monique Gignac and colleagues, including Dr. Arif Jedba. These resources were also informed by the experiences of many people living with arthritis, including them providing their input as well as their feedback and review of resources. These resources can be accessed on our website in English at www.arthritis.ca/work, or in French, please excuse my pronunciation, www.arthrit.ca/travail. The key objectives of our Arthritis and Work resource hub include to increase employee knowledge of arthritis management strategies, to empower employers to take a proactive approach, as well as to inform employees and employers of their rights and responsibilities. Arthritis Society Arthritis and Work resources include multi-format resources for both employees and employers. This includes videos, websites, printable PDFs, podcasts, and interactive tools. So for both groups, employees and employers, we cover what is arthritis, strategies for the workplace, which also goes into accommodations, your rights and responsibilities, as well as managing arthritis beyond the workplace. For employees, we've included an additional section of disclosing your condition. Here, we don't provide any advice. It's simply a matter of providing employees with tools to think through that decision themselves. And for employers, we've also included sections on creating an arthritis-friendly workplace and accommodating employees with arthritis. Within each of these sections on our website, there are multiple different tools and resources that can be accessed. In terms of our implementation strategy, we hosted a resource launch event hosted by TD Bank, as well as outreach to 36 organizations in the financial, manufacturing, construction, and other sectors. We sent out organizational emails and newsletters, both within the Arthritis Society and from the Arthritis Society, but also a number of the organizations we connected with sent out emails both to their own employees and externally as well. We also conducted in-person presentations and info fairs and launched a paid promotional campaign on Facebook and Google. In terms of our reach, we had some really positive uptake of our online module on Arthritis and Work with over 18,000 visitors to the module. We also received over 10,000 views of our Arthritis and Work landing page, 4,000 visitors to our online accommodation tool, and 2,000 views of our Should I Disclose video. We would really like to increase this reach though, and also increase reach of some of our resources that have been viewed less frequently. We conducted a 2-week survey online of our Arthritis and Work resource hub, and we had 84 respondents. So this is a fairly small proportion of people who have viewed the resources, but in terms of the people who responded to the survey, the results were quite positive. 99% agreed that the resource is helpful for people with arthritis. 92% agreed that the resource increased their understanding of accessibility standards and compliance requirements. 92% also agreed that the resource increased their understanding of the barriers experienced by people with arthritis. And 99% said they would recommend this resource to others. So this data includes input from both employees and employers. With regard to the challenges that we faced, we certainly had a lot more uptake by employees, and we had some challenges getting employer buy-in and uptake. We had some organizations that invited us in for presentations or to speak to their employees. However, we found that this pool was definitely more difficult to encourage buy-in. We also heard from a number of employees that while the resources on disclosure were helpful, many of them still didn't feel unsafe and didn't feel that their job was secure if they did choose to disclose. Additionally, we experienced challenges with long-term evaluation in that we were able to get some feedback immediately following people's interaction with the resources, but we'd really love to get more input on whether or not employers have implemented any of the strategies we've suggested, and whether employees have found this information useful, and whether it's changed their approach in the workplace. For next steps, the Arthritis Society is working on the creation of a financial security resource guide, which is intended for people who are unemployed, underemployed, or employed. And this will include information about regional and federal resources with regard to disability support programs and funding available, to disability tax credits, employment services, job retraining, and vocational services. And we're hoping to launch this in March of 2021. We are also working on increasing awareness of resources, particularly amongst employers, and revising our long-term evaluation strategy to hopefully get more feedback on how these resources have been implemented. We will also continue to consult with our online consumer panels to further identify needs. And our online consumer panels are a group of over 80 people living with different forms of arthritis who are incredibly important in providing input and feedback on the work that we're doing. If you have any questions about the Arthritis and Work resources or would like more information, I can be contacted at handerson@arthritis.ca, or you can visit the Arthritis Society website at arthritis.ca, or call our toll-free info line at 1-800-321-1433. Thank you. Back to you, Ron.
Thank you, Helen, and thanks to all of the presenters for a great session. We're now going to turn to the live question and answer part of the session.